Emmanuel.
Good afternoon to you.
We have come to your clinic here.
Yes.
How many staff are you here?
My name is Emmanuel Sankale. I'm one of the staff here. I'm a physiotherapist. And in our clinic here, we are 3 staffs. We have our consultant with Dr. Kinara Solomon. We have our support staff on the computer side by the name Emily. Yes.
For how long have you worked in this clinic, Emmanuel?
Thank you again. And there is actually, being sincere, there is my 4th month working with Kisii Physiotherapy Clinic. And actually, being sincere, the stay here has been good. And I can assure that the environment is very conducive both for patients and staff.
Yes, so Dr. we have seen here that you are a graduate of Arupe University with a Bachelor of Science in Physiotherapy.
Yes.
How do you find a relation with consultants, physicians, and other medical staff in relation with your profession? You cooperate on patients, or how does it go about?
Yes, actually, as a team, medical field, we work as a team. We work as an interdisciplinary team. But when we narrow down working on a specific condition for patients, we find that physiotherapy is very unique. It is a very special field where we have to do our work in a very different way. We do a special assessment. We formulate our goals, our objectives, and the plan that we have for our patient. Yes.
We have learned that, for example, if a patient is operated,
Yes.
and is sent to the ward but does not receive physiotherapy.
Yes.
What happens? Will that operation be beneficial, or will the patient have consequences as a result of not starting immediately physiotherapy?
Thank you for asking that question, actually, because I've encountered a number of patients with that condition. And I will say that thank you for this opportunity so that I can say 1, 2 on the same. Usually, post-op patients, we found that when physiotherapy is not done at initial stages or just post-operative, that patient is usually likely to develop more of the complications, a number of them being you will find that patient will be more likely to develop stiffness, malunion, non-union, contractures, which will impact negatively on the activities of their daily living, and also the quality of the life they will have after. So it is usually necessary and that physiotherapy be done immediately after operation, depending on the kind of operation that is done, either laminectomy, articulation, or amputation of all those conditions. So that patient usually is recommended. Physiotherapy is usually recommended for their well-being, to rehabilitate them back to their activities of their normal day.
The patients have given some testimonies
Yes.
about this clinic.
Yes.
And we have seen that it is necessary for the body to be kept, the strength of the body to be kept up to date, to avoid muscle loss, and also maintain balance. Most of the people who are around age 60 and above, they naturally start losing muscle power, muscle strength, and dizziness comes in if they are not active, and so on and so on. What do you advise as the generation ages in relation to physiotherapy?
Yes, actually, what you have just talked about, maybe you have not known, but there is a condition called sarcopenia.
Sarcopenia.
It is sarcopenia.
Yes.
That is the gradual loss of the muscle mass, muscle bulk.
Slowly, gradually.
Yeah, it is a gradual process where you find that with aging, there are some hormones that are produced that are always necessary for the development and the growth of the cells that are responsible for forming muscles.
Yes.
Yes, so with aging, you find that patients become very reluctant. They do neglect exercises, and they will gradually develop those complications. So it is advisable that advised and well-prescribed exercises for them so that they can live a healthy life
Yes.
thereafter.
And we also learned that some conditions that you people handle are like back problems and
Yes.
stroke.
Yes,
They are very prevalent in the current
yes.
stage. What do you say about them in relation with your specialty?
Thank you for that question. Actually, those are the most common conditions that come with aging. For the case of stroke, we have two types of stroke. Major one we have the ischemic one and ischemic stroke, and we have the hemorrhagic stroke.
Yes.
So the ischemic one is that one that comes with the brain cells dies due to lack of sufficient oxygen,
Yes.
sufficient blood supply to the brain,
Yes.
retiring them from getting enough nutrients and oxygen to the cells.
Yes.
The one that is called the hemorrhagic
Yes.
occurs when there is a complete or incomplete rupture
Yeah.
of one of the major arteries that is supplying the brain.
Yes.
So you find that the blood goes and it floods the brain cells. So the brain cells will die.
Yes.
Yes. So maybe to create awareness is that stroke can be managed, stroke can be prevented, and stroke can be treated by physiotherapists. We usually do manage the post complication of the stroke. There is the paresis, the hemiparesis. We have the stiffness of the joints. We have the facial paralysis. That is the facial palsy that usually comes after a patient sustains some stroke. So we do ambulation, we do activity modification, a number of them.
Oh, thank you. Do you do your work strictly in the clinic, or do you go and do some home visits for
Yes.
those who are unable to come to the clinic?
Yeah.
And also, do you have any insurance that you use?
Thank you for that. And actually, to clarify on the same, apart from the outpatient physiotherapy service that we offer in our clinic, we also do what is called home-based physiotherapy rehabilitation services. We do home visits, yes, at the patient's convenience. Yeah.
And the insurance?
Oh, currently the insurance that we have the CIC.
Yes.
Yes, and hopefully we are working on Britain, of which God willing, we are hoping that
Soon.
we shall also get that one, acquire that one.
That is quite well
Thank you.
answered,
Yes.
and this information will reach the right targets, and we will keep again revisit you maybe after 6 months
Thank you.
and see any new developments
Sure.
which we can have. Thank you so much, Daktari. God bless you.
God bless you too. Maybe to add on something maybe that we have forgotten,
Yes.
our clients or anyone can also access us through our website at Kisii Physiotherapy Clinic.
Yes.
They can also find us at TikTok, the Facebook, Instagram, and Twitter.
Thank you.
Yes, you can book your appointment there.
Online.
Online at our website. You can also do your consultation there.
Yeah.
Yes. Thank you.
Thank you. That is great information. We are looking forward to even more better improvements.
Thank you. And welcome.
Asante na mbariki.
Thank you.